In 2017, Duke did the first liver transplant in the Southeast under the HOPE Act. The HOPE Act was national federal legislation that allowed the use of an HIV seropositive donor into an HIV positive recipient. This had been pioneered in South Africa and published in the New England Journal with good results, and so it was clear that there was precedent and a rationale for using HIV positive donors that heretofore had been illegal in the United States.
We actually found out in North Carolina we had an added layer of complexity because our state had a number of fairly antiquated rules as well that prohibited the acceptance or the knowing donation of any tissues. And those rules were put into place with good reason 30 years ago, but did not meet, we thought, the current science standard. So we actually went to the legislature and, in fact, to the secretaries of HHS and asked to be exempted and to have those rules changed, and fortunately met with some pretty favorable responses, and actually were able to sort of lobby and successfully have many of those old and no longer quite so relevant rules taken away, which has allowed then this to move forward in a legally appropriate, not to mention medically safe way.
So Stanley Boling was our first patient who we transplanted, a patient of Dr. Berg's as the hepatologist. Dr. Ravindra did the liver transplant, and Dr. Cam Wolf was really the infectious disease expert that has shepherded the care of Mr. Boling.
Well, I've been HIV positive for quite a while, and I had to learn to deal with that illness. And probably it didn't help, when the liver started failing. It didn't help that I had been such a long survivor. But I didn't think I could have a liver transplant, as I said earlier, and then I got referred here. I was tickled to death. And of course, when I first came here and talked to you, you gave me two options. You said, you can say you want a non-HIV liver, or we have the HOPE Act where you can accept an HIV liver and maybe get it sooner. I mean, possibility of getting it sooner. And I liked that. And I'm not afraid of the HIV. Not after being treated for so long. I wasn't afraid of that. So I was very willing to be a part of that and hopefully to help future people that go through the same thing.
Yeah, so we've had a number of people who've been willing to accept HIV positive organs, both kidneys and livers, and yet Stanley was the first patient who actually got his offer from a donor who was HIV positive. And he's actually the first person to receive a liver transplant through this program in the greater Southeast. So it's, I think, regionally for us, a big success story that he's really done so well. He received an organ, as you said, just prior to Christmas. Having been in our program on the evaluation side of things for a solid sort of 6 months prior to that, really working himself up to that point. When the organ offer becomes available, again, there's almost two parallel teams working together. There's the surgical questions of, is this a good quality liver, irrespective of the HIV? And then from the infectious disease perspective, irrespective of the quality, is the HIV matching going to be adequate? And that, that's a lot of investigation that happens not only from our point of view, but also happens importantly from the organ procurement agencies side of the world. So, in this instance, the procurement agency that was able to facilitate this donation, in fact, did an enormous amount of effort to try and provide us with that information in a fashion that was timely. And that's often out of state for a donor. It may not be the donor's local. So there is a lot of tracking of records, matching of data, and that happens both on the surgical and hepatology side, but also on the infectious disease side. And, we're thrilled that so far, not only is he doing really well, but I think operationally we're able to prove that, yes, this is something that we really can do and do very successfully.
So it was a great Christmas present. It really was. It was done on the 22nd.
22nd,
yeah. During that, yeah. And so I like I said, the different teams, the one that was handling beforehand, and then in the hospital, and then the after care team, they've all been so great and had my best interests in mind, and very concerned. They came across very well with that. They're concerned for me and for family. That's very refreshing. And I took some of that back to some of my friends in the hospital where I worked and let them know, this can be done. It's not impossible.
Before the HOPE Act was actually legislatively put in place, some modelling studies had actually taken place to sort of look at nationally how many extra donors we think this could open up. And statistically, it was felt to be 500 extra donors, give or take a little bit. And so recognizing that those donors could be 2 kidneys and a liver potentially, that's a lot of potential recipients for whom this would be a unique pathway for them to receive a transplant. I think in reality it's worked out a little slower and a little less in terms of the numbers of that, mainly because it's not every family knows that their loved one could be a donor. This is not something that traditionally has been discussed in HIV clinics before, so folks have never sat down and really talked to their family to say, look, I know I'm HIV positive, but if I was to pass away, I would like to be a donor, whereas those conversations can now happen. Similarly, hospitals where a donor may be about to pass away don't necessarily yet know that HIV donation can occur, or at least they're only just learning about it. And I think equally on the recipient hospital side of things, folks always want to be a little cautious maybe as a new program is running to make sure they're doing it the right way and make sure that things are working as well as they can. So we're certainly not at the point where 500 donors have been used, in fact nowhere near that, but I think in terms of the numbers of extra patients that this may offer transplant to, it's still going to be pretty meaningful in the long run. And that's actually helpful for folks who are HIV negative too, because now my HIV positive patient awaiting a kidney, for example, is not competing against someone else on the waiting list for an organ that at the end of the day is incredibly scarce.